Understanding racial and ethnic disparities in the COVID-19 vaccine. Underlying health and social inequities put many racial and ethnic minority groups at an increased risk of getting sick, having more severe illness, and dying from COVID-19. For this reason, the COVID-19 vaccine is even more important. Racial and ethnic minority groups are experiencing higher rates of COVID-19 infection, hospitalization, and death. Social determinants of health, or SDOH, contribute to health disparities and inequities. These are the conditions and the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. It is important to note that many of the same social determinants of health that increase the risk of COVID-19 illness also increase the risk of health conditions such as obesity, high blood pressure, and diabetes. These specific social determinants include education, economic stability, physical environment, and healthcare system factors, such as insurance coverage, access to care and treatment, and more. Did you know about 1 in 10 people in the United States don't have health insurance? Inequities may increase the risk of severe illness associated with COVID-19, such as hospitalization, need for a breathing machine, or even death. A recent study found that people from racial and ethnic minority groups were more likely to have increased COVID-19 disease severity upon admission at the hospital, compared with non-Hispanic white people. According to the United Health Foundation's 2020 Annual Health Rankings Report, 6.6% of people in Delaware are not covered by private or public health insurance. Although there are thousands of people uninsured in Delaware, this does not limit the access to the COVID-19 vaccine. COVID-19 vaccines are free for everyone. In August 2021, the United States reached the goal of having at least 70% of adults vaccinated with 1 or more doses of the COVID-19 vaccine. While this represents a marked achievement, Black and Hispanic people have had persistently lower rates of vaccination compared to their white counterparts across most states. These lower vaccination rates leave Black and Hispanic people at increased risk for infection, illness, and death, particularly as new variants, like the Delta variant, spread. The data shows that, despite recent trends suggesting improving equity in COVID-19 vaccination patterns and a recent narrowing in the gap between vaccination rates for white and Hispanic people, disparities are persisting. Less than half of Black and Hispanic people have received at least 1 COVID-19 vaccine dose in nearly all states reporting data, including a number of states where less than a third have received a vaccine. These lower vaccination rates among Black and Hispanic people leave them at increased risk for coronavirus, particularly as new variants spread, potentially leading to widening disparities going forward and limiting the nation's recovery. You are important, and so is the COVID-19 vaccine. Through many efforts, the local communities are trying to reach all people right where they are. Community Health System Partnership for community-located vaccine clinics and pop-up clinics strive to reduce some of the barriers to care and keep you and your family safe. In many areas, community leaders have served a critical role in activating these networks and building a bridge of trust between the health systems and the community around vaccination. Important things to know. The Delaware Division of Public Health and its vaccinating partners are making vaccines available to anyone aged 12 and older. Lack of ID is not a barrier to individuals with undocumented immigration status. Photo ID may be required to verify age. Persons 12 to 17 years old are only eligible to receive the Pfizer brand of the vaccine at this time. Check with your healthcare provider, immunization department, or immunization department website for guidance on age restrictions. All healthcare providers, facilities, and entities that offer vaccinations are required to make those vaccinations available to any person meeting the vaccination criteria, regardless of that person's ability to pay, type of health insurance, or participation in any particular provider network. To find a community-based event or public health clinic where walk-in appointments are available, you can visit the State of Delaware website or call 1-833-643-1715. You matter. Your health matters. Take advantage of the vaccination opportunities that are available in your community to keep you and your family safe.